Wake up, it's a beautiful day. Wake up.
Yandra Vinaka, and we're continuing the conversation with Dr. Prithvi from MIOT Hospital, and he just shared in the previous segment about the collaboration with Fiji Care and some of the amazing initiatives that they're doing, such as their open heart surgeries, their cardio heart surgeries rather. I don't want to pronounce a word that's too much for me early in the morning. But sir, we were having a little conversation off record, and we talked about how sometimes people are too late when it comes to like heart diseases and stuff. And I just wanted to ask, why do you think that's so?
Well, I think that obviously there needs to be a little bit of awareness about the facilities that are available. People are sometimes afraid that they cannot get to the right place at the right time in Fiji. And as you're aware, we just touched upon the fact that there's a magnificent facility in Lautoka equipped to the hilt with the government involving Aspen to sort out the fit out and upgrade, and they've done a brilliant job. The machines there are the best of the best in the world. The operating theatres are just state of the art. And as you just heard, for the last 2.5, 3 years, we've been performing both open heart surgery and cardiology services. And as I explained to you, we do around 20 open heart surgeries every month.
Every month, that's
and we're doing 20 to 30 angios a week. And the team that performs this is a 35-member team that actually lives in Lautoka permanently, although they are from India. So this is not a fly-in, fly-out. This is a properly stationed, well-oiled, dedicated machine. And their success rate is around 99.5%. So that's incredible, especially as they've treated over 300 hearts now. So I think it's important for people to be aware that they don't have to wait. There is a good place to go to, and it's completely free of cost because it's provided by the government.
Exactly. And so you mentioned your state-of-the-art infrastructure, and we have here, like, you already mentioned the amazing work that you do, but besides that, how can the people in the Pacific benefit from the other services that MIOT offer?
So we're looking at other services, significant services that we could offer. Obviously here in Suva, there is a significant waiting list to access cardiac services, to access meaningful end-to-end cardiac service. So we run a hospital that has 3,000 full-time employees. We run 17 national board training programs back home at MIOT. So we can tap into people who are willing to come here and to stay here for a year at least at a time, and to render service in such areas. So we're definitely looking to see how we can up the offering on the cardiac side. And also endovascular interventions are here to stay. Patients who have a fibroid problem gynecologically can have that treated without open surgery. Patients who have a prostate problem can be treated without open surgery. And of course, patients who have knee arthritis can be treated without open surgery. And these procedures are done as a day procedure through a small sort of pinhole in the groin. You access the blood vessel that supplies these areas, and you address the blood vessel that is the culprit by knocking off the supply to the offending area. So if it is a prostate that's growing big, you can shrink it. If it is a fibroid in the uterus that's growing big, you can shrink it. And if there is synovium that is producing severe damage to the hip joint, you can shrink that as well. And these patients can go home immediately and they recover immediately. So there's no fear of anesthesia, there's no fear of open surgery, and there's no prolonged stay in the hospital. So these are services that we're looking at specifically for the Pacific.
And so I understand that over 130 countries use MIOT, access MIOT Hospital. Can you tell us about like some of the stats and some of the common countries that come to access your service?
Right. So all the neighbors obviously are the ones that are our principal people who we provide the service to. So this could be Bangladesh, it could be Nepal, Sri Lanka, obviously the Maldives, Mauritius, Seychelles, and then of course you have East Africa as well, some of the Middle East, especially Iraq, and then the old USSR countries like Tajikistan, Uzbekistan, Kyrgyzstan, and of course we have our outposts there. We have a 4-story day surgery unit in Seychelles. We used to run the neurosurgery, gastro and anesthetic unit for Maldives. And in Mauritius we have a massive stroke rehab center. So we do some of the treatments in-house, and of course the very complicated treatment, they have to come. But the journey is not like from Fiji
Exactly.
where it takes 14 hours. Here it just takes a few hours, couple of hours to reach India.
And so, okay, thank you, sir, for sharing that. And I just wanted to know something at the back of my mind. What's the aftercare like at MIOT Hospital?
Well, the aftercare is incredibly switched on, one-on-one. MIOT works like the military. The people who run MIOT have to live on site, so I live on site. I moved into the 14-acre premises 13 years ago. My family and I, my child, my pets, we all live on site. We start work at around 4 a.m. and we finish work at 7 p.m. So it's pretty dedicated, really the way healthcare should be provided.
Thank you so much, sir. We're coming to the end of our segment together. But before we end, is there any message that you'd like to give to our viewers, maybe those who are interested in coming into the profession, and maybe a separate message to those who are wishing to access MIOT Hospital?
Well, I think in terms of those who are coming to this profession, it is a profession where we need people who are compassionate, we need people who are energetic, and we need people who want to do it for the love of seeing a patient recover and for putting smiles on people's faces. This is not a profession meant for people who want to amass wealth. It really is a profession for people who care.
And sorry, sir, your message to those who want to access MIOT Hospital, but maybe they're a bit hesitant, what would you say to them?
Well, I think it is common for most people in various geographies when they fall ill to try to sweep it under the carpet. And I think that it's better to have a proactive approach with regard to your health. Without health, really, it's impossible for you to be happy, for your family to be happy, and for the next generation to have a better start in life. So it's very important to look after yourself.
And thank you so much, sir, for this informative segment. I am so enlightened today, and maybe I'll go get my insurance done with SEMA, maybe. Wink, wink. But thank you so much, sir, and all the best for the symposium that's happening today.
Thank you.
Stay with us. We have more after this short break.